concept that comes up more and more here in the office, almost on a daily basis, is the idea that annual labs or blood chemistry that you have done, if it looks good, means that you're healthy. And that's not true at all. The regular routine labs are used to monitor disease processes, and that's what their function is. So if you have labs that look good, that just means that you're not sick yet. But a lot of patients don't feel well, yet at the same time they're not sick in a way that we can measure it. So when our bodies get out of balance, we have to compensate for that. So we are meant to adapt to stress, and when we can no longer do that, we compensate. And when we compensate, multiple systems become involved. So chronic illness becomes very complex, and we can measure it with blood work or labs to tell us in a black and white way when you're sick, when you might need to be monitored then with, say, utilize medication, or a surgery might be needed. But it's really not that useful to tell you how healthy you are. So what I do here in the office is an evaluation as a functional medicine physician, where I'm looking at multiple systems and how your body's compensating for some sort of a weakness in your system that isn't bad enough to tell us on a chemistry, blood work, or an MRI or an X-ray or anything else that you're actually sick or ill, but at the same time, you're also not well. So that's a concept that I try to get across to patients and help them understand the difference between the testing that's done and what determines wellness and health, versus simply monitoring you for signs of disease.